Is it possible that your shoes are the cause of your foot, knee, and even your back pain? Today, Dr. Askey and I go over a post that says no, they don't. But we go over a number of reasons why your shoes matter. Watch and decide for yourself.
This is why you need to be careful with footwear advice on social media.
Remember we talked about the widest part of the foot should be the toes. So when you look at a shoe like that, that is not the widest part.
Now, I'm no foot doctor, but she's not either. She's a chiropractor who really likes feet. If that makes her a podiatrist, then that makes me a paleontologist, so I'll play along.
So when you put your foot in there, it's doing this. It changes the structure of the foot.
Wait, before you throw out your narrow Nikes, people have been saying that for 200 years. Still no proof. We used to think shoes were the most obvious cause of bunions. Turns out people who don't wear shoes still get bunions. We thought plantar fasciitis was caused by narrow shoes deforming your feet, because this study showed pushing your toes in like that does restrict blood flow. But first, is your toe really forced into that position in a comfy pair of Nikes? The researchers don't think so. Plus, 30% of the people had an increase in blood flow. So a narrow shoe doesn't even put enough pressure on your foot to cause a callus, probably because it takes an insane amount of force just to deform the thin connective tissue that covers your whole body. As far as I can tell, the only way a shoe is going to deform your foot is if you break all the bones, mash them into a shoe 8 sizes too small, and never take them off. Also known as foot bounding, which stopped 100 years ago because it's torture. See the difference?
When it's in that position, it changes the structure. If I walked around with my arm in a sling for 10 years, would my bicep get weak? If you don't use it, you're going to lose it.
So I respect his review of literature, but he tends to cherry pick and hyperbolize things because it gets clicks. I'm a firm believer that like wide toe box shoes, like my feet feel better. And I use the analogy with patients, like I'm not a podiatrist, but I know feet better than 90% of the podiatrists in this town. And I don't see the carryover between paleontologist and chiropractor when we treat feet and we study feet, and we studied feet in a anatomy lab and learned all the neuromuscular innervations and origins, insertions, and blood supply of all these things. You didn't study any paleontology in chiro school. I'm a firm believer that narrow shoes don't cause bunions, but they can irritate bunions if you got a big old prominence and bony callus poking into a narrow shoe. And I do believe you can generate more athletic force if your toes are able to splay. If you tracked how many push-ups you could do with your hands like this, you could do a lot more than if your hands are like this. Like when patients are squatting or lifting, I tell them, like, I want you to visualize having a gecko foot. Like, just get as much surface area in contact with the ground. And just narrow shoes, like he says they don't cause calluses. I beg to differ.
Yeah.
Because I've seen a lot of pinch calluses on patients that don't run. And I've seen a ton of gnarly calluses that are worthy of the pedicure scene from Dumb and Dumber on ultra marathoners and marathoners. And I've seen a lot of marathoners and half marathoners with black and blue toenails that probably wouldn't happen in wider footwear. It just, if you understand the mechanics of the foot, like if you look at the Gate Geeks, they're big fans of Topo shoes, which are wider toe box. And I would put those guys up against any podiatrist in the country. As far as knowledge, biomechanically and functionally on the foot, ankle, anything lower extremity, they would mop the floor. Like they would probably make a lot of foot and ankle fellow orthopedists self-conscious about their knowledge about mechanics of the foot, ankle, and lower extremity as a whole. And they're buying into the wide footwear, not because it's a trend or they can profit off of it. But I think that chiropractor made some sweeping generalizations that
one who made the post, not the one.
Yeah.
Okay.
And then Aaron just latched onto that like blood in the water. And it's like, yeah, you kind of made some generalizations based on single research studies that are 30 years old. So it's not necessarily a blood flow thing. It's a mechanics thing.
definitely a mechanics thing. And this kind of goes back to what we were saying about the cross body action, about how the body works together. Specifically, having that great toe jammed inwards, you're not toeing off properly, which means you're not pronating, which is why feet, by the way, get flat because your body's trying to get you to the opposite side. So your body is forcing itself to shift over by putting itself flat. So, yeah, I mean, the blood flow or, the calluses in the feet are a bummer. But like the biggest thing is how the foot works in relation to the rest of the body. And having a wide toe box, especially your toes, your foot has so many receptors. Like it's a very sensitive area. I don't know if anybody's ever tickled your foot or, you've stepped on some rocks, even some light stuff. Your feet are very sensitive. So your feet, there's a sense called proprioception where your body needs to know where it is in space. And the foot is very important. And when you're kind of closed off like that, it's like it's blind essentially. And so the mechanics is far more important. So like, you could talk to the gate geeks far more about this, but the big toe off, the arch coming down, the tibia internally rotating, the heel stabilizing, all of these things need to happen. And they happen more naturally when it starts at the toes, like when the toes are in a good spot, because those are the most sensitive points.
Yeah. And if you look at things on a continuum, isn't a narrow shoe just a less intense version of foot binding?
Basically, yeah.
And it's like, all right, women in China where their feet were bound, their feet are not very functional
Right.
at all. So, do you want to make your feet less functional on that continuum, or do you want to give them more space to be a foot?
100%. And I mean, I think this easily, we can take it even further, but it goes into the knees. So, like, if your big toe is bunioned in like that, it's stuck in like that, and you can't shift over, oftentimes that leads to a lack of extension. So, sometimes people without that big toe extension will hyperextend their knee. And so you'll get a lot of anterior knee pain just because their knee is kind of buckling backwards or the hip doesn't extend. Both can kind of happen as well. Or you're not shifting over to the other leg and you've got problems on the other leg. But the natural mechanics have to be what we're aiming for. And a wide toe box suffices to allow the natural mechanics better than the narrow toe box.
Yeah. And if you stay on the outside of your foot, what side of your knee is that going to put more pressure on? The inside.
Yep.
And where do people develop arthritis in their knee first? The inside.
Side, yep.
Just because of the bony shape of the knee. The femur is longer on the inside part of the knee. So there's more pressure on that inside part. So you're just aiding and abetting the problem.
100%. Yeah, you got to watch out. I mean, I've talked to Aaron before. He's been on the podcast a long time ago. He's a nice guy and he means well. And I know that he's what he's doing. But again, these research studies, you can cherry pick all sorts of stuff. And again, in a previous episode, we're just going to always reference previous episodes. Research lasts about 18 months as far as uh its relevance, and so you got to be careful. I had a physical therapist comment because I had a post that went pretty viral recently where I was doing some rotation and they were like, rotation is horrible for the spine. And I was like, what are you talking about? Your spine is always rotating. You put one leg in front of the other, you reach one arm, you look to the left. We're constantly rotating. So you need to be able to rotate. It's back to your comment about like birth. And she was like, I'm going to send you a research study. It was from 1970. And I was like, I'm not even going to read this because it's from freaking 50 years ago. Like, we need to catch up here.
Yeah. And I have a lot of respect for Meekins and Aaron and like, don't
Yeah,
view this as me bashing them because I have a lot of appreciation for their intellect and I know why they're doing what they're doing. And if I could sit down and have a beer with him, I'm pretty sure that we would be friends.
For
And I
sure.
think this is besides the point, but I think that we've become so tribalistic that if you don't agree with everything someone says, that they're your enemy.
Right.
And what boring world are we going to spiral into where you can't have some disagreements? Like you've seen like me and Offenberger like scream at each other for an hour, and then we realize that we can come to an agreement, and it's either agree to disagree, or it's like, well, I respect your opinion and I respect you as a person, and we're still best friends and we can get along. And it's just like, okay, like we don't have to be mortal enemies because we disagree on these little mini points or stylistic points of practice.
Exactly.